Greetings everyone and welcome back to my channel. Once again, my name's Tamika, and today it's been put on my heart to share with you and talk to you once again about part two of the Black Pain Scale. I spoke about it in a previous video, and I talked about how oftentimes when you're living with chronic pain and you're faced with healthcare professionals, they want you to rate your pain scale on a level of 1 to 10, with 1 being the slightest or the least pain you ever had, and 10 being unbelievable, off the charts. One of the things I noted in that video was it was not appropriate and relevant to chronic pain sufferers like myself, because we're constantly living with pain. So the question isn't 1 to 10. The question really becomes, how is your pain impacting your day-to-day functioning? How is your pain impacting your mood? How is your pain impacting your ability to socialize, to do the things that you normally like to do, or to do the things that maybe you would like to do more of in the future, or stopping you from doing the things that you normally were able to do? So recently, the reason why I wanted to follow up with a part two on this was when I went to the ER. I was instructed by the nurse, actually, because I was trying to explain why I feel that the pain scale didn't really, it wasn't very appropriate in the way that she was asking me the question. So I'm figuring, okay, I'm going to describe my scenario in a way to get the results, the intended results that I need and the care that I came for to begin with, right? So I begin to start to explain to her about how I have the pain every single day, and where it's located and what it's like, and what describing how the pain feels, and the stabbing, the constant throbbing, the discomfort, the inability to sleep, the sleep disturbances, just the impact on my overall functioning, the reason why I have to move about. I can't be in one position. I can't be sitting, standing, or whatever for too long, because again, that aggravates my particular chronic pain. So after hearing that, at least she was kind enough to listen. She still said, and paraphrasing, it's better though if you give us a number, because this way you can get seen faster. It helps us, I guess. This is their training. This is where the rubber meets the road, and this is the issue that I'm talking about, how it's not culturally competent for us, particularly for us as Black women and for us as Black people. They're trained on this scale, and so that's basically the only way that they can understand pain management, especially when you show up at the ER. This is not a pain clinic. These aren't pain specialists. They don't know you when you show up at the ER unless you have a history there, and sometimes that can be to your detriment depending on what it is you're showing up at the ER for. Some of us do not have a primary care physician. I'm fortunate. I do have a primary care physician, but I still have to do a lot of my own advocacy, and it's tiring. And I have a team, per se. I have more than one specialist involved in my care and my treatment. So the training of the pain scale, first and foremost, is limiting for BIPOC, for individuals. That's Black, Indigenous, people of color. For a Black woman like myself, who has been living with this kind of pain consistently for at least 6 months or more, because again, that's the cutoff that they'll ask you, have you had these symptoms for at least the past 6 months? Then that gives the idea that there's something more to it. There could be something going on. But the idea is I should suffer for 6 months before my pain is taken that seriously to get the help that I need. Now, for me, I've been suffering for longer than 6 months. My journey, my story, is a lot more encompassing. There might be another time for me to get into that if that's something that all of you are interested in. But what I really want to emphasize here is why, again, the pain scale is so limiting. So I ended up having to give the nurse a number, because, again, I can't reinvent the wheel. If this is their thinking, they're not going to be thinking outside of the box. The Canadian healthcare system isn't exactly known for being flexible, especially when it comes to the care, treatment, access, and management for Black people. for people who identify as Black, and particularly for Black women. If you look at the race-based statistics, if you can find them, they're few and far between, and we're not at the top of the agenda by any stretch of the imagination. So once again, I'm here in the situation with the pain scale. I gave a number. I'm not going to say the number because I don't really think the number matters. It's not going to necessarily get you anything more. As I said, I received extra strength Tylenol in the 5.5 to almost roughly less than 6 hours that I was at that ER, and I got 2 referrals. So from the advocacy point of view, I got what I wanted out of it. From the pain scale point of view, from being culturally incompetent, for not recognizing my needs as a Black female, from the Canadian healthcare system not being able to be sensitive enough and to be versatile to recognize that Black women have different healthcare needs and what it looks like, and why it's important to have people who are trained differently, who are trained to understand to maybe use these tools that they are given in their training, but not so exclusively that they are limiting for people who look like me. For a Black woman like me, I was able to show up at the ER and speak on what it is that I needed in that moment. That doesn't mean that I felt that I got everything that I needed. That doesn't mean that I think the pain scale is the best thing ever and it was helped me to my advantage, and thankfully it's there. Not by any stretch of the imagination, but this is the system that I'm in. This is a system that I have to figure out how to coalesce and how to work within. So maybe where you are, it might look different. Maybe where you are, you have more appropriate Black healthcare intervals and interventions and supports. If you do, please do share, even if they are not in the Greater Toronto area. It's just good to know that there's a community out there. There's a community out there of Black women who are living with chronic pain, who are battling mental health challenges and issues, who are just wanting to know that there's a space where they can be seen and heard, who just want to know that actually what they're going through is real. It's not just in their head, and that they can have a space where they feel safe. I want this channel to be a space of safety and a space where we can exchange knowledge and resources. I'm happy to share more of my journey, but I don't want this to be just about me and my journey, because it's not about necessarily myself going on and on and on about me. I really am sharing this as a way for my healing so that I don't have to keep it up here. I can get it out, and I can get it out to the world, and maybe others can see it and see what I've experienced, and maybe they can add on to it. Maybe they can subtract from it. Maybe the way I'm approaching it isn't the best. Maybe you have other suggestions or recommendations. I know this video is a little bit longer than typical, and I do apologize for that, but I really wanted to get across today that part 2 of the pain scale is still thumbs down from Tamika. I don't think it's racially appropriate. I don't think it's culturally competent, and I don't think it serves the interest of Black people, of Black women, and Black women's pain and Black women's suffering. Black women deserve to be cherished. We deserve to be seen and not silenced. We deserve to be heard, and our pain and our experiences are real, and they deserve to be authenticated. I'm glad I could share that with all of you today. I hope you have a blessed day, and I hope that me sharing is helping people who are listening, if anyone is out there listening, and I hope that you're taking away something from it. And I'm just glad that I can share my experiences for everybody out there. Take care, and God bless everyone. Bye.